After 20 years practicing medicine, one thing still surprises me: how often the danger doesn't come from disease itself, but from what we trust to treat it. I remember a patient named Margaret. She was 64, the kind of woman who followed every instruction carefully. Her mornings were simple, predictable, almost comforting. One quiet morning, she stood at her kitchen sink, warm sunlight slipping through the window, her hands gently rinsing a coffee cup. Nothing felt unusual. No warning, no pain. And then, everything stopped. Her heart. Just like that. How does something so sudden happen in a body that seemed so managed? When I later reviewed her medical history, it told a story that many people never see. Not a single illness, but a collection of prescriptions. Each one justified, each one approved, together forming what looked like a carefully constructed safety net. But was it? Or was it something else entirely? You see, research suggests that as we age, the body becomes less like a fast-moving river and more like a quiet pond. Substances that once flowed through easily begin to linger. The liver slows, the kidneys filter more gently, and what was once processed in hours can remain for days. Imagine pouring drop after drop of dye into still water. At first, nothing changes, but slowly, invisibly, the entire system shifts. Margaret wasn't just taking medication. She was living inside a chemical environment her body could no longer fully control. And this raises a difficult question. What if the very routine designed to protect her was quietly overwhelming her system? Because what happened next reveals something even more unsettling. Margaret's story may feel rare, almost unbelievable, but what if I told you that scientists have been quietly observing a pattern like this for years? A pattern so subtle it rarely makes headlines. It's often called a silent epidemic, not a virus, not a sudden illness, but something far more complex and far more overlooked. Research indicates that a significant number of health complications in adults over 60 may not come from disease alone, but from the interaction of treatments themselves. This is known as iatrogenic harm, when the very process of care begins to introduce new risks. But how does something designed to heal begin to harm? Think of the body as an orchestra. In youth, every instrument plays in harmony, timed, balanced, responsive. But with age, that harmony becomes more delicate. Now imagine introducing multiple new conductors, each giving different instructions, each altering the rhythm. At first, the changes seem small. A pill for blood pressure, another for cholesterol, something for occasional pain, perhaps something to protect the stomach. Individually, each decision makes sense, but together? Studies suggest that these combinations can create overlapping effects, subtle shifts in blood pressure regulation, nutrient absorption, even electrical signaling within the heart. And because these changes happen gradually, they rarely trigger immediate alarm. Have you ever noticed how something can feel slightly off for weeks, but never urgent enough to question? That's often how this begins. A little more fatigue, a bit of dizziness when standing, a strange heaviness in the muscles. Nothing dramatic, nothing obvious, but beneath the surface, the body may be working harder than ever to maintain balance. And this leads to a deeper, more unsettling question. What happens when that balance finally gives way? There's a quiet shift that happens inside the body as we grow older, one that rarely announces itself, yet changes everything. It begins in the organs we depend on most, the liver and the kidneys. In younger years, these systems work like a finely tuned filtration network, swift, precise, almost effortless. Every substance that enters the body is processed, transformed, and cleared with remarkable efficiency. But over time, research suggests this process begins to slow. Not suddenly, not dramatically, but steadily. Like a dimming light you barely notice until the room feels different. Have you ever poured water through a fresh filter, watching it flow freely, and then compared it to one that's been used for years? The difference is subtle at first, then unmistakable. The same may be happening inside the body. Studies indicate that kidney filtration rate can decline with age, while liver enzyme activity becomes less responsive. This means substances, especially synthetic compounds, may remain in circulation longer than intended. And here's where it becomes more complex. What happens when one medication lingers and another is added before the first has fully cleared? This is where accumulation begins. Margaret's body, like many others, wasn't failing suddenly. It was adapting, compensating, trying to maintain equilibrium in an environment that was becoming increasingly dense with chemical signals. Imagine a crowded room where everyone is speaking at once. At first, you can still hear individual voices, but eventually, it becomes noise. The body faces a similar challenge. Signals overlap. Systems compete. Balance becomes harder to maintain. And yet, from the outside, everything can still look normal. Until one moment changes everything. So the question becomes, what was the first signal in Margaret's body that something was no longer in harmony? The first signal is rarely loud. In fact, it almost always whispers. In Margaret's case, it began with something she never thought to question: her cholesterol medication. A small tablet, taken faithfully each evening. A routine that felt protective, responsible, even life-saving. But what if that tiny pill was quietly asking the heart to function with less energy? You see, research suggests that certain cholesterol-lowering medications work by blocking an enzyme in the liver responsible for producing cholesterol. But that same pathway is also responsible for creating something far less talked about, a molecule called coenzyme Q10. CoQ10, a substance so vital that every cell in the body depends on it, especially the heart. Why the heart? Because the heart is not just a muscle, it is an engine, beating over 100,000 times a day, requiring a constant supply of energy at the cellular level. And studies indicate that CoQ10 plays a central role in mitochondrial function, the tiny power plants inside each cell. Now imagine an engine running smoothly, and slowly, almost imperceptibly, the fuel supply begins to drop. At first, nothing seems wrong. The engine still runs. The rhythm continues. But over time, efficiency declines. Fatigue appears. Subtle weakness begins to build. Have you ever felt a kind of tiredness that sleep doesn't quite fix? Some researchers have observed that long-term use of these medications may be associated with reduced CoQ10 levels, and in certain individuals, this can coincide with muscle weakness, even affecting the heart muscle itself. Not immediately, not dramatically, but gradually. And this raises a quiet but powerful question. If the heart is being protected on one level, could it be strained on another? because what came next in Margaret's routine added an entirely different kind of pressure. Margaret didn't take her next medication every day, only when she needed it. A headache, a sore back after gardening, the kind of ordinary discomforts that come with living a full life. She would reach into her cabinet, take a familiar tablet, and within an hour, the pain would fade. It felt harmless, almost reassuring. But what if that temporary relief was quietly shifting something deeper? Research suggests that common anti-inflammatory medications, often used for pain, work by blocking enzymes involved in inflammation. On the surface, this seems beneficial. After all, inflammation is often linked to discomfort. But here's the hidden layer. Those same enzymes also help maintain the protective lining of blood vessels and play a role in regulating blood flow to the kidneys. Imagine a river with carefully balanced banks. Remove too much support from the edges, and the flow becomes unpredictable, sometimes turbulent. Studies indicate that in certain individuals, especially over 60, these medications may be associated with increases in blood pressure, fluid retention, and additional strain on kidney function. Subtle changes, often unnoticed at first. Have you ever experienced slight swelling in your feet at the end of the day and brushed it off as nothing? In Margaret's case, these small shifts were not isolated. They were happening alongside everything else her body was already managing. And when multiple systems begin adjusting at once, the body works harder to maintain equilibrium. But there's another layer many people never consider. What happens when this type of medication interacts with treatments already affecting blood pressure or circulation? This is where the story becomes even more complex and far more important to understand. Margaret believed she was protecting her body in every possible way. When her doctor prescribed something to protect her stomach, it felt like an added layer of safety. After all, if medications could irritate the stomach, wouldn't it make sense to shield it? It seemed logical. But what if protection in one place quietly created vulnerability in another? Research suggests that certain acid-reducing medications work by significantly lowering stomach acid production. This may ease discomfort, but stomach acid isn't just there for digestion. It plays a crucial role in absorbing key nutrients: magnesium, vitamin B12, calcium. These aren't just vitamins and minerals. They are electrical stabilizers, structural supports, silent regulators of the body's most vital systems. Now, imagine trying to power a home with unstable wiring. The lights may flicker, the system may strain, and eventually something critical may fail. Studies indicate that long-term reduction in stomach acid can be associated with decreased absorption of these nutrients, and in some individuals, low magnesium levels have been linked to irregular heart rhythms, sometimes dangerously so. Have you ever felt an occasional flutter in your chest and wondered what caused it? Margaret never connected these dots. To her, each pill had a clear purpose. Each one made sense on its own. But inside her body, something else was unfolding. A slow depletion, a quiet imbalance. And just as her system was adjusting to this hidden deficiency, another medication was shaping the rhythm of her heart in a completely different way. What happens when the heart's natural response system begins to soften? Margaret's heart had always been steady, dependable, quietly strong. So when she was prescribed a medication to help regulate her blood pressure, it felt like a sensible precaution, something to ease the workload of the heart, something to keep things calm. And in many ways, that's exactly what it did. Perhaps too calm. Research suggests that certain medications designed to slow the heart work by reducing its response to adrenaline, the body's natural signal for alertness and action. This can lower blood pressure and reduce strain. But here's the question few people ask. What happens when the heart needs to respond quickly? Imagine a fire alarm that has been turned down so low it can barely be heard. Most of the time, everything seems peaceful, controlled, quiet. But in an emergency, that signal may not be strong enough. Studies indicate that in some individuals, especially with long-term use, this dampening effect may be associated with slower heart rates during rest, particularly at night. And in certain cases, it may influence energy levels, mood, and even cognitive clarity. Have you ever woken up feeling unusually heavy, as if your body hadn't fully reset? Margaret occasionally felt that way, a kind of quiet fatigue she couldn't quite explain. But like many people, she adapted, she adjusted, she kept going. Because nothing felt urgent, nothing felt alarming. And yet, beneath that calm surface, her body was becoming less responsive, less adaptable, less prepared for sudden change. Which raises a critical question. What happens when a system designed to protect becomes too quiet to react? Because the next medication in her routine would push her body into an entirely different kind of risk. There's a delicate balance inside the bloodstream, one that most of us never think about. It's the balance between clotting and flowing, between protection and risk. Margaret's doctor prescribed a medication to prevent dangerous clots, a decision that, on the surface, made perfect sense. After all, clots can lead to heart attacks or strokes. But what if altering this balance too much creates a different kind of danger? Research suggests that medications designed to thin the blood work by interfering with the body's natural clotting mechanisms. This can reduce the likelihood of blockages, but it also makes the system more fragile. Imagine walking across a tightrope. Lean slightly one way and you risk a clot. Lean too far the other, and even a small misstep could lead to bleeding. Studies indicate that in older adults, this balance can become increasingly sensitive. Minor injuries that would once heal easily may take longer or behave unpredictably. Have you ever noticed how a small bruise can seem more dramatic than expected? For Margaret, this medication was just another layer of protection, another safeguard. But combined with everything else her body was managing, it became part of a much larger picture. Because the real story isn't about one medication. It's about what happens when all of them begin interacting at once. A statin affecting energy production, an anti-inflammatory influencing blood flow, a stomach medication altering nutrient absorption, a heart regulator slowing response, a blood thinner changing internal balance. Individually, manageable. Together, something else entirely. And this is where the concept of a chemical storm begins to emerge. Inside Margaret's body, there was no single moment where everything went wrong, no sudden switch, no clear dividing line. Instead, research suggests that when multiple medications interact, their combined effects can create overlapping signals, small disruptions that begin to compound over time. This is sometimes described as polypharmacy, the use of multiple medications simultaneously. And studies indicate that as the number of medications increases, so does the complexity of their interactions. But complexity isn't always visible. Imagine standing in a room where 5 different conversations are happening at once. At first, you can follow each one, But gradually, the noise overlaps, clarity fades, and confusion takes over. The body experiences something similar. Blood pressure signals compete with fluid regulation. Nutrient deficiencies influence electrical rhythms. Energy production declines while demand remains constant. And through it all, the body keeps adapting. Until it can't. Have you ever felt like your system was simply overwhelmed without knowing why? Margaret's collapse was not a mystery to her body. It was the final moment in a long chain of quiet adjustments, a tipping point. And yet, what makes this story so important is not just what happened, but what could be understood from it. Because within this complexity, there is also a path forward, a different way of thinking about health, one that doesn't begin with fear, but with awareness. So the question becomes, what if the body has been waiting for a different kind of support all along? There's a quiet shift happening in how scientists understand aging, and it doesn't revolve around adding more, but sometimes understanding what may be too much. For years, the focus has often been on managing individual symptoms, one solution for one problem. But research increasingly suggests that the body doesn't operate in isolated parts. It functions as an interconnected system. And when that system is supported holistically, something remarkable can happen. Balance begins to return. Energy feels more stable. Clarity improves. Small daily moments, like walking up a staircase or stepping into morning light, feel just a little easier. Why? Because studies indicate that certain natural compounds and lifestyle patterns may support mitochondrial function, reduce chronic inflammation, and help restore internal equilibrium. Think of the body not as something to be controlled, but as something to be supported, like tending to a garden rather than forcing growth. Margaret never had the chance to explore this path, but her story invites a powerful reflection. What if health isn't just about adding more layers of protection, but about understanding what the body truly needs? Have you ever noticed how sometimes doing less, but with intention, can feel more effective than doing more? This isn't about rejecting medicine. It's about understanding its role and its limits. Because the goal isn't just to extend life, it's to preserve the quality, the clarity, the vitality within it. And that realization leads to one final, deeply important step. There's one question that can quietly change everything. Not a dramatic decision, not a sudden shift, just a question. Margaret never asked it, not because she didn't care, but because she trusted the system completely. Like many people, she believed that each prescription was a permanent necessity rather than a temporary tool. But research suggests that as the body changes with age, the way it responds to treatments can also change. What was once appropriate may not always remain so indefinitely. So here is the question. Is this still necessary? Simple, calm, yet incredibly powerful. Imagine sitting across from a doctor and exploring not just what you're taking, but why, how it's being monitored, how it interacts with everything else. Have you ever paused to look at the full picture, rather than each piece individually? Studies indicate that regular medication reviews may help reduce unnecessary complexity and improve overall well-being in older adults. Not by removing everything, but by refining, adjusting, understanding. Because true health is not passive, it is participatory. It grows from awareness, from curiosity, from a willingness to gently question and learn. And perhaps that is the most important part of Margaret's story. Not what happened, but what it can teach. That the body is always communicating, always adapting, always seeking balance. And sometimes the most powerful step forward begins with simply listening, because what you discover next might change everything.